Excellencies, distinguished delegates, ladies and gentlemen, good morning, good afternoon, and good evening from the Netherlands. My name is Francis Hübner, Communications Officer and student at the Rotterdam University of Applied Sciences, as well as a former member of the IFFD Academic Training Program. I'm very honored to conduct this event today. This year, the IFFD briefing and award ceremony will be held virtually once more. We will address mental health in families, inclusive and resilient recovery from COVID-19.
Thank you, Francis. Well, I'm Alex Vasquez, a representative of IFFD, the United Nations, and I have the honor to appreciate the co-sponsorship of the permanent mission of the Republic of Botswana to the United Nations and the support of UNDESA. And now I have also the pleasure to introduce to Mr. Olivier Yao, IFFD's World President and Head of the Federation in Ivory Coast. Mr. Yao, you have the floor.
Excellencies, ladies and gentlemen, I would like to take this opportunity to wish you a year 2022 filled with good health, permanent joy, constant serenity for you and your dear ones. Research has repeatedly shown during the past month that the pandemic-related stress has affected mental health in families, especially parents, teenagers, and children. Studies are focused on the impact of backfiring behaviors by parents, as well as parental behaviors that potentially exacerbated the effects of children's exposure to the pandemic and its consequences. We therefore totally support the appeal by the United Nations Secretary General Antonio Guterres for countries to put mental health front and center of their responses to and recovery from the COVID-19 pandemic. In this regard, we welcome the release of the policy brief entitled COVID-19 and the need for action on mental health, which sends a strong and clear message on the importance of the issue to the international community and set guidelines on our country should promote and address mental health issues as part of the COVID-19 response. In line with what have been expressed by the permanent representative of Bahrain, Belgium, Canada, and Ecuador, I would like to highlight the impact of the pandemic on mental health and well-being of the whole society. These issues do not affect only just a specific group in society. It impacts different groups, notably children, young people, women, people in humanitarian and conflict settings, older adults, and people with pre-existing health conditions, first responders, and frontline healthcare workers. As in the other aspect of the sustainable goal number 3, on ensuring healthy lives and promoting well-being for all and all ages, the role of the family has shown once more to be essential. The study we undertook with UNICEF and the experts from the 5 continents says that family policies are a mainstay of national public policies and the most meaningful vehicle for government to influence the standard of living of future generations. Given the important role of life science choices in health outcomes, the family environments can inevitably play an important role in many health behaviors that are often established from childhood carried out to adulthood. Parents and the other family members can therefore act as early promoters of healthy living. Family functioning or dysfunctionality can play an influential role in the formation of support networks for adolescents. Family can also constitute a source of stress and depression. Finally, very dysfunctional families can also harbor perpetrators of domestic violence, abuse, leading to physical injury, hospitalization, or suicidal ideation. Numerous studies have shown that social relationships, particularly family relationships, can play both long and short-term effects on one's mental health. Depending on the nature of these relationships, mental health can be enhanced or negatively impacted. To provide evidence about this issue, some of the most recent and prestigious studies will be presented by the authors today, and the IFFD awards are also focused on the help given to families in vulnerable situations, especially the young generations who have to struggle in the middle of the pandemic to start a family through decent job, adequate housing, and social protection. Let me finish by thanking Dr. Nirmita Panchal, Professor Andrea Spencer, Professor Brenda Jones-Harden, and Professor Susan Walker for making it possible. Je voudrais également remercier son Excellence Pietro Kowalski et M. Thierry Véron pour leur travail dans la région polonaise de Kujawsko-Pomorskie et l'Organisation française familiale, ainsi que Renata Kajmarska de la Division des politiques sociales et développement des Nations Unies pour leur soutien et leur encouragement constant. Thank you very much to all of you, and I wish you a fruitful session.
Thank you, Mr. Yao. I have the pleasure now to introduce to His Excellency Ismael Dabuta, Deputy Permanent Representative of the Republic of Botswana to the United Nations. Excellency, you have the floor.
Thank you, moderator, for giving me the floor. Distinguished ladies and gentlemen, it is a great pleasure for me to join you this morning on this special occasion of the 10th edition of the International Federation for Family Development briefing. At the outset, allow me to indicate that the permanent mission of Botswana to the United Nations is pleased to be co-sponsoring this briefing because we share the IFFD's belief in an inclusive COVID-19 recovery. The theme of the briefing, mental health in families, inclusive and resilient recovery from COVID-19, emphasizes the need to incorporate the family in COVID-19 recovery policy choices. This is important because the family is the primary social institution and a basic building block of society. Solve challenges facing the family, then you'd have solved many problems in society, and by extension, the country and the whole world at large. In this regard, IFFD should be commended for shining a spotlight on issues of mental health in the family setting and within the context of the COVID-19 pandemic. Without a doubt, the stress, anxiety, grief brought about by the pandemic has taken a toll on many families, resulting in high cases of depression, broken families, suicides, and gender-based violence or domestic violence. The pandemic-induced spike in domestic violence has been so rampant that it has been described as the shadow pandemic or a pandemic within the COVID-19 pandemic. In view of the pandemic-related mental health problems, as the IFFD observes, parent-child relationships have in some cases, or in most cases, been negatively affected. Therefore, the IFFD seeks suggestions on improving affected parent-child relationships for the betterment of the family institution. I will address this within the broader context of mental health intervention. The way I see it, Mr. Moderator, the process of enhancing mental health well-being within the family setting requires a multi-stakeholder approach. That includes the families themselves, governments, the private sector, civil society, school, the media, among others. All these actors ought to recognize and pay adequate attention to the mental health implications of the pandemic on their employees, customers, children, extended family, and come up with their own tailored policies and programs which are aimed at promoting mental health. I should however note that since the pandemic hit, we have seen some good intentions from various, good interventions rather, from various quarters in response to mental health needs. These include counseling, support centers, hotlines, and public campaigns. However, these have fallen short, especially due to limited access to medical health services to most, especially the disadvantaged communities, either due to non-availability, stretched resources, or exorbitant fees. It is these issues that also need to be addressed to make access to support easy. At the same time, ladies and gentlemen, the elephant in the room is access to vaccines. Many people, especially in the developing countries, remain unvaccinated due to unavailability of our vaccines. We need to work more on this because no one is safe until everyone is safe. We know, Mr. Moderator, that during the pandemic, there has been a lot of lockdowns, restricting families in their houses, thereby denying the normal support and thereby resulting in all these issues that I'm talking about. So we need to make sure that vaccines are available. Everyone who wants to be vaccinated is vaccinated, and those that do not want to take vaccines are encouraged to take vaccine so that we can get back to normal life and be able to address the issues of mental health especially, and also address adequately the issues of recovering of the economies, because the result of mental health comes from different aspects. It is the lack of resources in terms of families not being able to finance their well-being, but also it is the staying indoors, being locked up with your only families, or maybe alone for that matter, that result in depressions and these broken families that I'm talking about. But to conclude, ladies and gentlemen, I wish to underscore the importance of promoting mental well-being in the family environment. The promotion of mental well-being in the family and other facets of society should be part of the process of building back and recovering better. And from the pandemic, and leaving no one behind. As I said, if no one is safe until everyone is vaccinated. Thank you, Mr. Moderator.
Thank you so much, Your Excellency, and definitely that will resonate throughout the event. No one is safe until everybody's safe. And I really appreciate your presence here. And now we will continue with the event. That's why I'm going to give the floor to Francis to continue with our panel discussion.
Thank you very much, Mr. Yao. We now turn to the interactive discussion about evidence-based policy recommendation on mental health in families, inclusive and resilient recovery from COVID-19. To provide evidence and practical recommendation about this issue, some of the most recent and prestigious studies will be presented by their authors in this year's edition of the IFFD briefing. The discussion will be moderated by Professor Susan Walker, Associate Professor at the University of Minnesota, Department of Family Social Science. Professor Walker, you have the floor.
Thanks so much. It's wonderful to be here today. I'm coming to you from St. Paul, Minnesota, where the temperature is about 12 degrees and we have snow on the ground. So wherever you are in the world, I hope your weather is lovely and everyone is safe today. Well, I'm very, very excited to be here today. We have three absolutely amazing, distinguished speakers who will present to us information about the impacts of COVID and general conditions affecting the mental health of children and families. As we know, families work as a system, and so even an impact on a single member of our families can have ripple effects on all of us. One of the things that we've discovered, especially with COVID, if there's a bright side to any of this, is that it has exposed certain vulnerabilities in our system. And so our three speakers will present to us more than the current research that they have on COVID and mental health, but they also will be presenting to us a motivation for action for policies and for programs that we can enact as individuals and as a global society. And so with that, I'm going to turn to our first speaker, Dr. Brenda Jones-Harden. Dr. Jones-Harden is the Allison Richmond Professor for Children and Families with the School of Social Work at the University of Maryland. Dr. Jones-Harden.
Thank you. And let's see if I can show my slides. Oh dear, I might not be able to. Let's see. Let's see if I can show them. Just 1 second. Okay, well, it looks like they're coming up. So I'm just really, really honored to be here, to be a part of this effort of IFFD, part of the United Nations. It is really an honor for me to be a part of this experience. So I think you can see my slides now. What I want to talk briefly about is the research that I've been involved with, but also some of the other research that my colleagues have been involved with about the impact of the COVID pandemic on young children and their families. Hopefully you can see my slides. Okay, so I want to bring up a conceptualization by a pediatrician in the United States, Jack Shonkoff, and what he talks about is the impact of toxic stress on children and families. And just to tell you a little bit about this, I'm not going to go into great detail, but what he argues is that when you experience chronic stressors as a child or as a young person, that those stressors can be moderated or buffered, if you will, by a positive caregiving relationship. And I want us to hold on to that as we go through some of these data on the outcomes of the COVID pandemic, because what this particular conceptualization suggests is that that family, that caregiving relationship that a young child has can buffer them against the impact of COVID. So just to sort of go deep a little bit, the way Shonkoff describes toxic stress is this strong activation of the stress response system. But what he argues is that that happens only in the absence of stable adult support. So in other words, if your family's supporting you as a young child, you are less likely to have the negative impacts that a stressor like what I have in red, COVID-19, causes to your body, but also causes to your psychological well-being. So let me just tell you a little bit about the research that we have done and my colleagues have done about children's development. First of all, we know that there's a huge impact on children's physical health, as it turns out, because kids are less active. They're doing more screen time, including school and playing games. So what that leads to is irregular sleep patterns, and we're seeing increases in weight gain among children and loss of cardiorespiratory fitness. And some of these health effects are obviously exacerbated by being stuck in the home or being stuck in a classroom in school in a pod where you can't sort of go out and interact with other kids in the school, etc. Now, of course, there are also, and this is sort of the focus of this session today, lots of impacts on children's mental health. And what we know about these psychological stressors are, one, it's come from this prolonged duration of the COVID pandemic. You know, at first, none of us ever expected that this would last for 2 years. So imagine us as adults cognitively trying to process that and what that means for a young child who really can't think it through. All they know is that this keeps going on and on and on. But also children have lots of worries. Am I going to be infected? Now they know they're bombarded by the media, and they know that, you know, young children, for example, cannot be vaccinated. So they worry, is my little sister, my little brother going to get COVID? Am I going to get infected? Because every time I turn around, I go to school, they shut it down, send us back home because somebody has COVID. They're also frustrated and bored. They don't get the proper information about it. And we have not, as a society, I think, done a very good job of really helping children to understand it. We're getting better. There are books for children and things like that, but there really needs to be much more emphasis on having children understand this pandemic and what it means for them, particularly the temporary nature of it. Clearly, the lack of in-person contact has caused a lot of trouble with kids. They can't see their grandparents who might be in a hospital or some kind of assisted living facility. And also the instability of school. You go to school one day, you don't go to school another day. So that is certainly, children are the biggest conformists. They like things to stay the same. So when there's all this instability, that causes them even more stress and anxiety. Of course, everybody's at home now, which is a good thing. It's a good thing for us to be close. But as the mantra says, let there be space in our togetherness. So a lot of times children don't have any personal space at home, particularly if they're children who live in very, very small quarters. Clearly, the loss of family finances is a huge issue across the world. In the United States, we have seen particular losses among the service industries, where a lot of families of young children, particularly from impoverished backgrounds, work. So these kinds of things have affected children's worry. You see heightened levels of food insecurity and all kinds of other anxieties. And I just wanted to tell you about one study. As you all know, a lot of times children are being quarantined, particularly now when they go to school and somebody has COVID at school and then they have to go into quarantine. And there's some research that post-traumatic stress is 4 times as likely in children who are quarantined when compared to children who are not. And we're just seeing lots of level of what we call internalizing problems in children, high levels of anxiety in particular. Now, On the family side, just like we have heard a little bit about before, we have found that there are increases in family conflict, including intimate partner violence, domestic violence, but also child maltreatment. And in the United States, as many of you know, we have a big child protection service system. And what we saw over the pandemic is a decrease actually in the numbers of reports to our child protective service system. And many people have suggested that it has to do with the fact that children are not typically in their normal environments like childcare and school, and those are the people who typically do child protection reports. So although we've seen a decline in the numbers of kids reported, there's some suggestion by some studies that there is actually an increase in child maltreatment, partly because parents are stressed themselves and they have no respite from their children. And any of you who are parents know that everybody needs a little bit of respite from their children. On the parental mental health side, again, we have seen higher rates of internalizing issues, lots of depression, lots of anxiety. And one of the other speakers is going to speak to you about the higher rates of substance abuse. In the US, for example, we're seeing higher rates of opioid use and other kinds of drugs. Clearly, work-related issues. This is a huge, huge issue in the US, and I would suspect across the world, where we're seeing increasing rates of unemployment. In the US, we call it the Great Resignation, but a lot of people have had to resign their jobs because they've had responsibilities for their children at home. There's no childcare for them, etc. But also many of them have been let go from their jobs because small businesses just couldn't keep open in the middle of the pandemic when people were not using their services and buying their products. But interestingly enough, we're also seeing this issue with essential workers who have to go to work, like who are frontline nurses and things like that, but also frontline childcare providers, frontline emergency technicians, those kinds of things. And a lot of parents or young children have those kind of jobs. And what happens is they have non-traditional hours. So there's, again, children don't have the stability of school. They don't have the stability of their parents coming home. But then, the big worry of exposure to COVID and what that means for children, particularly when the little ones cannot be vaccinated. Now in our country, the 5 to 12-year-olds can be, but I'm sure, as has been discussed already in this session, that in other parts of the world, the 5 to 12-year-olds have not received vaccinations. Okay. I do want to say something about racial, ethnic, and SES disparities in this country, which really has relevance to many countries across the world, that we are seeing a higher rate of minority families and low SES individuals, in other words, individuals from impoverished backgrounds, more likely to be hospitalized and die from COVID. This is a huge issue in the United States. I'm sure it's an issue across the world where the people who are most vulnerable to all kinds of other health disparities are also vulnerable to these COVID disparities. So this is a huge issue for us in this country, what we can do to ensure more vaccinations among low-income and minority individuals, but also to ensure that they get the health care they need to be able to survive. We're also seeing, as you would imagine, we're also seeing disparities in the functioning of families of young children. And I'm on the advisory board of a big study that's surveying parents across the United States. And what we're finding is for parents and children from low-income backgrounds, there are higher rates of social emotional challenges as well. And we think some of that might be due to the fact that there is certainly decreased income among these families, increased financial difficulties, and greater material hardship generally for low-income families. So in recent months, we've seen middle-income families sort of kind of come back almost to baseline, where they, are not reporting as many material hardships, but for low-income families, this is still a struggle. And obviously, that is important when you think about what kinds of supports families have, and low-income families are reporting lower levels of social support in general, right? They're isolated from many of their supports, including childcare and Head Start and things like that we have in the U.S. But their childcare is being particularly affected. Many childcare centers and homes are closing down, so families who need these kind of resources to be able to keep their jobs are not getting them. So we certainly see that affecting what's happening with low-income families. I just want to shift now, and I'm going to not go through all these slides bullet by bullet, but just to say that yes, there are all these things that are happening, but as a psychologist and social worker, I want to make sure that we also think about ways to promote the most positive outcomes that we can. Like I started with that toxic stress definition, in the absence of stable adult support. So we want to make sure that children get that kind of stable adult support so that they can be buffered against some of the sequelae of what's happening with this pandemic. So clearly we want lots of child-centered activities. That's one of the laments that I had earlier, that we haven't done as much to explain to children what this is about. We haven't done as much to create active experiential learning virtual experiences for children. I think Sesame Street is a good model of what can be done, and certainly I wish that school systems had the time to kind of pivot and use some of those kind of methods instead of just putting children on an iPad, and clearly focusing with them on proper hygiene and health, like washing hands and what wearing a mask means and all that kind of stuff. We want to make sure that parents support their children in order to, again, buffer them against some of these negative mental health outcomes like post-traumatic stress and anxiety. We want to make sure that parents communicate to their children, are responsive to their needs, really give them opportunities for play and storytelling and reenactment of these kinds of things, but also having these calming activities that help children to sort of down regulate from the anxiety that they might be experiencing. And routines are critical for young children. Also, we want to make sure that the family has extra time to do things that typically bring them joy. So if watching a movie, if dancing and listening to music, if running around or engaging in virtual religious activities, any of those things that bring joy to families, bring contentment, help them calm down, we want to make sure that those are elevated. And really saying to kids that your feelings of worry are normal. We also want families to really give themselves a break. In other words, not expect that they'll be able to be the best parent in the world. Just say, I'm doing the best I can. And also making sure that they give themselves small breaks from the situation, even if it means standing outside and looking at the sky, or going into the bathroom and shutting the door, whatever they can do to give themselves small breaks for their children. And also really being a good role model about how to handle worry and anxiety, because young children in particular, are looking to us as models for how they should handle their own worries. And just quickly, because obviously we know that families have experienced a lot of loss and death and illness from families getting sick from COVID, really having a good family culturally based ritual to handle that, and giving children the opportunity to write about it, to draw about it, to think about it, to feel about it is critical. We've been doing a lot of concrete supports in our work, certainly. And so we think that's important, like making sure folks get telehealth visits. And I'll just close by saying, we have to take care of ourselves. If we want to be good for children, we want to be good to ourselves. So with that, I'll turn it back over to Susan.
Thank you so much, Brenda. Everything that you mentioned just hit the mark. I study and teach about technology use in families and children, and at the same time do a lot with supporting parents. and everybody is worried and everybody is concerned about screen time. And, you know, just letting everybody know you're doing great. Just, you know, just take a breath. We're all in this together. We'll get through this, and be kind to yourself and spend time with your children, and everybody's in this together. So thank you so much for your presentation today. It was absolutely wonderful. So our next speaker is from the Kaiser Family Foundation, Nirmita Panchal. She is the Senior Policy Analyst, again with the Kaiser Family Foundation program on the ACA and the program on Medicaid and the uninsured in Washington, D.C. And with that, we will turn it over to Dr. Panchal.
Hello, and thank you for the opportunity to present today. My name is Nirmita Panchal, and I am speaking on behalf of the Kaiser Family Foundation. In my presentation today, I will focus on the recent rise in poor mental health in the United States. I will also share how parents and children in particular have been affected. Health landscape in the United States, the pandemic, roughly 20% last year, deaths due to drug overdose increased over time, and suicide was a top 10 leading cause of death. During the pandemic, many of these mental health and substance use issues have been exacerbated. As shown in this slide, to the right, we see that 32% of adults reported symptoms of anxiety or depressive disorder. Although this is a slight decrease from earlier in the pandemic, it remains well above the 11% of adults reporting symptoms of anxiety or depression 2 years ago. There have been concerns around how has been affected. Families have experienced a number of hardships, including loss of income, lack of childcare, and increased stress and pressure, which may all be linked to poor mental health. Research has found that many parents have reported worsened mental health since the pandemic began. As we see in this slide, adults in households with symptoms of anxiety and children, pandemic, contributing to poor mental health among parents, including job loss and other financial hardships. Job loss is associated with increased depression, anxiety, distress, and low self-esteem, and may lead to higher rates of substance use disorder. As shown in this slide, many adults in households with children have reported job loss or difficulties paying for basic expenses compared to adults in households without children. In addition to financial hardships, many parents have had to balance both work demands and childcare. In light of the pandemic, schools and childcare centers have often faced closures. Mental health insurance. As we see in the slide, in December 2021, 37% of mothers reported feelings of anxiety or depression, compared to 29% of fathers. This difference by sex has generally held steady throughout the pandemic. In general, women in the U.S. have been more likely to report poor mental health compared to men before and during the pandemic. Recent research has found that among women with jobs outside of their home, more than 1 in 4 considered leaving their jobs or reducing their hours during the pandemic, primarily due to burnout and how impacts from the pandemic have been more pronounced among other groups of parents as well, including parents from some communities of color. For example, higher shares of Black and Hispanic parents. These communities of color have also experienced higher. Recent survey from the Kaiser Family Foundation, we found that in addition to poor mental health, parents report a number of, for example, large shares of parents report that their ability to care for their children and their relationship with family members have been negatively impacted. Additionally, nearly 3/4 of parents report their children's education has been negatively affected. This brings me to my next slide. If we are finding that parents in the U.S. have been negatively impacted, how are children faring? What we knew going into the pandemic was that the poor mental health of parents can adversely affect children's mental health. Although data has been limited, research has shown that children's mental health has worsened during the pandemic, alongside parents' mental health. Children have experienced a wide range of symptoms, including irritability, clinginess, and fear, and have had issues with sleeping and poor appetite. As shown in this slide, 22% of young children ages 5 to 12 have experienced worsened overall mental or emotional health since the pandemic began. Data not shown here has also found that over 20% of older children report worsened mental and cognitive health as well. There are several other important considerations in regards to children's mental health. U.S. media reports suggest that child abuse may have increased during the pandemic, although the data remains unclear. It is possible that increased stress and poor mental health among parents may be associated with an increase in child abuse. Child abuse can lead to immediate psychological issues and long-term mental illness and substance use. Data on children during the pandemic, particularly data broken down at the demographic level, has been limited in the U.S., as was the case even before the pandemic. This makes it challenging to understand the scope of children's mental health and identify populations that may be particularly vulnerable at this time. What we do know is that prior to the pandemic, children of color and children from low-income households were at higher risk of mental illness and were less likely to access care. Suicide rates were also increasing faster among Black children compared to children of other races. The current mental health crisis affecting parents and children comes at a time when services are strained. More than 1/4 of adults with mental health issues have reported not receiving needed mental health care during the pandemic. It is possible that certain populations are more likely to not receive care, including some communities of color. Prior to the pandemic, Black and Hispanic communities were less likely to receive needed care compared to the general U.S. population. Several policy measures and other responses have been initiated in light of the current crisis. In 2021, the American Rescue Plan Act was passed. This bill included funding for mental health and substance use disorder services. A portion of these funds were also designated for children and adolescents' mental health. The practice of using telehealth for mental health care has also greatly increased, allowing those in need to access providers while continuing to socially distance. Many health insurers have expanded their benefits to include mental health care services accessed through telehealth. Large shares of employers offering health benefits also made changes to their benefits in order to address increased mental health issues. These changes included reduced costs for services and expanding access to services, for example, through telehealth. Despite these responses, many questions remain as to how mental health care needs will be met going forward, particularly for more vulnerable populations. There are likely long-term implications for the health and well-being of many adults and children. It will be important to understand how these communities are impacted through further research. This concludes my presentation. Thank you for the opportunity to present today. If you have additional questions, please feel free to email me at the address provided on the slide. For more information and resources on mental health from the Kaiser Family Foundation,
Thank you, Nirmita. That was, I have copious notes here about all of the various impacts on childcare and financial impacts, mental health, substance use, the need impacts on education disparities, and this directs us completely to the need for stronger programs and policies to assist children and families. And finally, our third presentation is from Andrea Spencer. Dr. Spencer is the Assistant Professor of Psychiatry and the Director for Pediatric Integrated Behavioral Health Care at the Boston University School of Medicine at the Boston Medical Center. And with that, I will turn it over to Dr. Spencer.
Hi, everyone. Thank you very much for having me. My name is Andrea Spencer. I am a child and adolescent psychiatrist at Boston Medical Center and the Boston University School of Medicine. And today I'll be talking about my research on changes in psychosocial functioning among urban elementary school-age children in the United States during the COVID-19 pandemic. This research was recently published in the journal Child and Adolescent Psychiatry and Mental Health. And I also, before I begin, would like to acknowledge my funders. I have been funded over the past 3 years by the Gordon and Betty Moore Foundation, the Charles H. Hood Foundation, the National Institute of Mental Health, and the Boston University Clinical and Translational Science Institute, who also funded this study. And also, I am a mom to 2 young children, and these children have experienced the COVID-19 pandemic, and this might affect my reporting on this issue. Children have faced many pandemic-related adversities. And in the US, racial and ethnic minoritized youth are disproportionately impacted by pandemic-related stressors. So these include things like social isolation, school closures, academic problems, increased screen time, stressed caregivers, sickness, worry, loss, financial difficulties, difficulty accessing healthcare. And people are worried with good reason about a surge in psychosocial problems among this generation of children, and particularly among our most vulnerable children. And we sought out to understand how this was impacting our community. First, we wanted to compare mental health symptoms before the pandemic to mental health symptoms during the pandemic in our urban, racial, and ethnic minoritized population. And we also wanted to compare social risks before and during the pandemic. Social risks are things like food insecurity, housing instability, difficulty paying bills, etc., that have impacted many, many families during the pandemic. And we also wanted to examine the relationship between these two things. So how have social risks impacted the mental health of children during the pandemic? And we also wanted to explore the relationship between child mental health and other pandemic-specific stressors related to things like school participation, screen time, parent mental health, etc. So we did this by conducting a cohort study. We enrolled school-age children between the ages of 5 to 11 years old from our urban safety net hospital-based pediatric primary care practice in Boston, Massachusetts. We are a safety net hospital at Boston Medical Center because we care for everyone regardless of ability to pay. And so our eligible subjects were children age 5 to 11 years old, over 900 of them who came in for primary care visits, well child visits, in the 6 months before the pandemic began in Massachusetts. And this period was from September 2019 to February 2020. And during this well child visit, these children were screened for mental health symptoms and for social risks as part of usual care. Our enrollment period was between August 2020 and January of 2021. And during that time, we called all of these families, and 168 of them consented to participate in the study. And in the study, we administered these same mental health screeners and social risk screeners that we did as part of usual care before the pandemic. The mental health screener we used is the pediatric symptom checklist, or the PSE-17. This is a parent report checklist with 17 items measuring various emotional and behavioral symptoms. This is a well-validated and widely used screener that is available in many different languages. And in fact, it's used throughout the US and also internationally. The PSE-17 includes a total problem score that measures overall mental health symptoms, as well as 3 subscale scores measuring internalizing symptoms or depression and anxiety symptoms, externalizing symptoms or behavior problems, and attention symptoms indicating attention problems. For social risks, we measured these using the Thrive, which is a BMC developed social risk screener. It's also used as a parent report checklist of social risks and needs in primary care at BMC, and it includes items on food, housing, employment, medication affordability, transportation to medical visits, education of the primary caregiver, ability to pay bills, and caregiving needs. And what we did is that we calculated individual risks before and during the pandemic. And we also calculated a total risk score indicating how many needs a family had. And during the pandemic, we also measured parent mental health using a 2-item depression screener, the PHQ-2, and then the GAD-2 to measure anxiety symptoms. These are also well-validated screeners, often used in primary care, and here used just during the pandemic to try to understand how parents' mental health was and use that in our analysis. We also looked at other mid-pandemic stressors, and these variables were measured by expert consensus. They were developed by expert consensus and used to measure school participation, screen time, media exposure to COVID-19 related information, knowing someone who contracted COVID-19, and then an open-ended question that we asked families, please tell us anything else you think is important about how COVID-19 has impacted your child's health or well-being. So here are the characteristics of our sample. We had 168 families enroll. Mean age of the child was 8.5 years. Slightly more males than females enrolled. And you can see that our sample is predominantly non-Hispanic, Black, and Hispanic. Very small percentage of non-Hispanic white families, and that we administered surveys in 3 languages, English, Haitian Creole, and Spanish, and that the majority of our sample of children was publicly insured. So first, we thought to compare mental health symptoms and social risks before and during the pandemic. Here in this graph, we looked at mean PSE-17 scores, which indicate severity of mental health symptoms. And you can see the blue column represents pre-pandemic scores on the total problems scale, and then each of the subscales, internalizing, externalizing, and attention. And then the red column represents mid-pandemic symptoms. And you can see across the board on the total problem score, as well as the other subscales, children had more mental health symptoms in each of these areas during the pandemic compared to before, and all were highly statistically significant. Then we looked at the percent of children who scored positive on the PSE-17 total problem score, as well as the 3 subscale scores. And a positive score means that the child exceeded the clinical cutoff on that overall scale or subscale, indicating clinically important symptoms in that area. And so you can see here that during the pandemic, more children scored positive on the total problem scale compared to before the pandemic. And on the internalizing subscale, more children scored positive during the pandemic than before the pandemic. But these results were not significant for externalizing problems and attention problems. I want to highlight the internalizing problems column for a minute because 18% of children, remember the age range is 5 to 11 years old, scored positive for clinically important depression and anxiety symptoms during the pandemic compared to 5% before. And there you see the most dramatic increase of clinically important symptoms that we see developing during the pandemic. Here you see social risks, the change from pre-pandemic to mid-pandemic. And you can see that the percent of parents with specific social risks just really increased for almost all social risks during the pandemic compared to before. And just to highlight a few, you see that 50% of our sample reported food insecurity during the pandemic compared to less than 20% before. We also had dramatic increases in housing insecurity, difficulty with dependent care, loss of employment, and then difficulty paying bills. So then we sought to understand the relationship between child mental health symptoms and social risks during the pandemic. And to do this, we used a path model. The path model allows you to understand the relationship between multiple variables. And here we have temporality as a factor. So we know that we have pre-pandemic social risks and pre-pandemic mental health symptoms, and we're trying to understand how these impact each other, as well as mid-pandemic PSC 17 scores or mental health symptoms, and mid-pandemic social risks or Thrive scores. So first, what you can see is that pre-pandemic mental health symptoms were significantly correlated with pre-pandemic number of social risks. So pre-pandemic PSC 17 total scores are significantly correlated with pre-pandemic Thrive scores. And we actually knew that that was going to be true because we had maybe 4 years ago, we had analyzed some EMR data showing us that this was the case in our clinic. But surprisingly, in our model, where it allows us to control for other variables as we examine each of these relationships, in the model, there was no significant correlation between mid-pandemic PSC 17 and Thrive, either at the pre-time point, so no significant correlation between pre-pandemic Thrive and mid-pandemic PSC 17, and no significant correlation between mid-pandemic Thrive and mid-pandemic PSC 17. So what this means is that we're not seeing mental health symptoms increase mainly as a result of increases in social risks. We do see dramatic increases in social risks, and really this is quite pervasive, but that specifically doesn't appear to be driving the increase in mental health symptoms for children. And so the next question is, what is driving that increase? What other pandemic specific stressors are impacting child mental health? And here we get a sense of some of those variables that we measured that are associated with increases in mid-pandemic mental health symptoms. So we found that less school assignment completion was associated with increased mid-pandemic mental health symptoms. Increased screen time during COVID-19 was associated with higher mid-pandemic mental health symptoms. And higher parent depression scores on the PHQ-2 was associated with higher mid-pandemic child mental health symptoms. In our open-ended question, please tell us anything else you think is important about how COVID-19 has impacted your child's health or well-being. Parents mentioned lack of activities outside the house, social isolation, fear and anxiety about COVID, trouble with remote learning, sadness, depression, change in general, stress due to finances and basic needs, and lack of exercise or weight gain as things that were impacting their child's health or well-being. In conclusion, we found quite dramatically increased depression and anxiety problems and social risks during the COVID-19 pandemic compared to before among this cohort of predominantly racial and ethnic minoritized school-age children in our urban pediatric primary care setting in the US. But interestingly, dramatic increases in social risks did not explain the rise in depression and anxiety symptoms mid-pandemic. What we did find is that low school participation, increased screen time, and high parental depression symptoms were associated with increased mental health symptoms in children. And so, in terms of what to do, I think one thing that's very important that we consider is how the public mental health system really needs to play a role here. And I think that when we think of public health during this pandemic, we think about things like masks and social distancing and vaccines, and these things are all extremely important. But together with public health virus mitigation strategies, we need to be thinking about a public mental health effort. The reason I emphasize a public mental health effort is because no increase in the mental health professional workforce, just take as one example, is going to meet the dramatic need that we see here. It's too broad, and there are too many kids deeply impacted. And what we're seeing is a mental health impacts on communities. And so what needs to happen is increase resources going into communities to manage this situation. This funding should go to things like engaging children and families back in school, improving access to outdoor and enrichment activities in communities, reducing screen time, helping parents to reduce screen time in part by engaging them in school and improving access to other activities to get kids out of their houses and off their screens. And then of course, supporting parents financially and emotionally will be extremely important going forward. Parents need to have their own oxygen masks on to be able to support their kids. And this will be extremely important going forward. And our data shows that. I wanted to, in conclusion, acknowledge all of my co-authors on this study. This was really a team effort and wouldn't have been possible without all of you. And thank you.
Thank you, Dr. Spencer. And finally, we're turning to Erica Commissar, who is a clinical social worker, a psychoanalyst, parent coach, and author in New York City, to give us a few final words from her own perspective.
So, and I do have a slightly different perspective. Thank you all for coming. In that this mental health crisis was happening before COVID. So COVID has been an amplifier, but it hasn't been the cause of this mental health crisis. There's an epidemic of children and adolescents suffering from mental illness. Even before COVID, 1 in 5 children were experiencing mental illness before they left adolescence in America. And there was a 400% increase in children taking medication for depression in the last 20 years. According to a recent Surgeon General's report in America, during COVID, rates of anxiety and depression doubled, with 20% of youth experiencing depressive symptoms and 20% experiencing anxiety. In addition, rates of suicide tripled. In the UK, the recent Big Ask study reported 1 in 6 children, up from 1 in 9, were suffering from mental illness. This is not an American phenomenon, but a worldwide crisis. But we have to understand this is not due to COVID. COVID has amplified what was, our children were already fragile before COVID, which led to these breakdowns. We're asking children to handle more stress, more stimulation, more pressure, more choices, and more decisions, without giving them a secure foundation of support, emotional security, and real and meaningful connections to cope with the emotions that come with these challenges. Then we wonder why our kids collapse when the emotional, social, and hormonal storm of adolescence hits. As governments, we have to support families in the first 3 years to keep mothers and babies together as long as possible and as much as possible to create the bond of attachment security, which lays down the foundation for mental health in the future. Institutional daycare is not the solution and is becoming part of the problem. intergenerational childcare may be the solution. Longitudinal studies regarding attachment security report that children who are not provided with the emotional and physical presence of a primary attachment figure in the first 3 years, the majority of the time, are more likely to suffer from mental health issues and attachment disorders later in life. For the last 60 years, we have had such a focus on getting women into the workforce as early as possible that we have traded adult freedom, gender equality, and economic security for the emotional security of our children. There has to be a balance, and only governments, educational institutions, private industry, partnering with families and parents can make this course correction. In addition, prevention, early diagnosis, and accessible and affordable treatment is necessary throughout childhood and adolescence if we are going to stem the tide of this epidemic. Parent education, intergenerational family support, and childcare, as well as providing educational institutions with the necessary tools, staff, and knowledge to assess and address these mental health concerns as early as possible, are critical tools in this fight. Only by taking firm action in changing our attitude, recognizing that children are not born resilient to stress, but in fact are born incredibly neurologically fragile, and without giving them an emotionally secure foundation, they will continue to break down in great numbers. We know we may not be able to control all environmental stressors, but we can make sure to reinforce the emotional security, which is the foundation of resilience to stress. Thank you.
Thank you, Erica. What a wonderful lineup of speakers we've had this morning, or well, my morning, probably your afternoon. Thanks to everybody who has presented this morning today. We've heard just a wonderful, comprehensive viewpoint on the conditions facing children and families. And as Erica and others pointed out, COVID may have exacerbated some of these conditions, but again, they were conditions that were long present before COVID hit. One thing too, I would just like to point out is IFFD has identified some of the key studies and we were able to present those today. But these are from the United States, and as a number of the speakers have mentioned, this is a worldwide phenomenon. And I would say that if we look at the resources and conditions pre-COVID, we'll have a good idea of where the differences may lie. So for instance, one of the differences, say with technology access, when Dr. Spencer speaks of children's school participation, in some countries in the UK, there are greater and lesser access to the internet and greater and lesser access to computers in the home, which of course is then going to impact students' ability to participate in school. The note on parental mental health and screen time and school participation are obviously right on. And one of the things I would like to point out with that is, again, very systemic. If we're looking at the impacts on children, the impacts on parents, who are the #1 folks to help children be able to attend school and do their school and be able to monitor and mediate children's screen time. And so as we're looking at parents' mental health, and we step back and we look at our societal supports, including parenting education, including mental health care, including the quality of our schools, to provide resources for families. The one thing I would want to add to the wonderful array of presentations from our speakers is for us to also support the professionals. So as we are beginning to identify, or we continue to identify the myriad supports that families need, that have been identified here through our presentations, and many that we are already aware of, for us to understand that the professionals who are on the front lines, who are there to support families, who are there teaching children, who are there providing health care and mental health care for children and for families, who are providing the vaccines, who are providing COVID testing, are under tremendous stress. And as we've seen, I believe it was Dr. Jones-Harden in her first presentation alluded to the great flight of people from their jobs. And this is due to stress, that they're facing as well. And so when we're looking at our system of care for individuals, for children, and for families, that system involves professionals and their support and the resources that they need and their own mental health care. So as we're giving big hugs to families and children, we give big hugs to the professionals who are directly supporting those families as well. So thank you everybody for attending, and I very much appreciate everybody's participation today. We are not done. We have a lot of work to do, and I would just leave everyone with trying to remain optimistic because we are in this together. And I do believe that by working together through the work of the IFFD and the many, many myriad agencies, universities, researchers, programs, practitioners out in the world, that we can support each other and we can get through this. So thank you all very, very much. And I will turn it back over to Alex.
Now we have reached the most awaited part of the event. Now we will learn how a European region is establishing effective family policies. Also, how a national organization helps families to acquire and consolidate skills and build lasting and quality ties among their members.
The local government of Kujawsko-Pomorskie region has been consistently implementing an ambitious social and family responsive program, elements of which appear in all developmental strategies adopted. They also have plans to consolidate and develop this approach in the future. As a significant step, the Regional Assembly last October 25th adopted the accession of the region to the Venice Declaration as a new member of the Inclusive Cities for Sustainable Families project for a vast majority of votes. The document was signed by Marshal Piotr Salbecki and the President of the Regional Assembly, Elżbieta Piniewska. Therefore, the government of the Polish region of Kujawsko-Pomorskie has been granted one of the 2022 IFFD awards for the establishment of family support centers to offer comprehensive and specialized support for families, allowing parents and other caregivers to strengthen their competencies and through the follow-up of the Sustainable Development Goals and the Venetian Declaration, especially during this challenging time of the pandemic. Congratulations on your award.
Wszystkich witam, serdecznie pozdrawiam z województwa kujawsko-pomorskiego, z Grodu Kopernika, czyli Torunia, grodu, gdzie urodził się Mikołaj Kopernik. Ja nazywam się Piotr Całbecki i jestem marszałkiem naszego regionu. Pozdrawiam wszystkich uczestników posiedzenia Komisji Rozwoju Społecznego ONZ. Niestety ze względów pandemicznych nie możemy się spotkać w Nowym Jorku, ale wiem, że podejmowane dzisiaj dyskusje, chociażby dotyczące zdrowia psychicznego, wynikającego z sytuacji pandemicznej na świecie, zobowiązują nas tym bardziej do wzajemnego wsparcia, podzielenia się doświadczeniami. Ja za to chcę dziś w sposób szczególny na forum ONZ podziękować wszystkim Państwu, którzy przyczyniliście się do tego, iż zostaliśmy laureatami. Przyznana nam została nagroda bowiem Międzynarodowej Federacji Rozwoju Rodziny. Tejże federacji, która 20 października pozwoliła nam na podjęcie uchwały z Sejmiku Województwa Kujawsko-Pomorskiego o włączeniu nas do rodziny regionów, organizacji, instytucji wspierających deklarację, czy przyjmujących deklarację wenecką. Niezwykle ważnego dokumentu, który, jak wiemy, ma sprzyjać zrównoważonemu rozwojowi rodziny i w ogóle cywilizacji na całym świecie. To dla nas ogromny zaszczyt. Chcę za tę nagrodę podziękować, szczególnie Roberto Ciambettiemu, który zainicjował jako przewodniczący Rady Regionu Veneto włączenie naszego województwa do rodziny państw weneckich, ale z drugiej regionu weneckich, a z drugiej strony Ignacio Sociasowi, czyli dyrektorowi do spraw komunikacji i stosunków międzynarodowych Komisji Międzynarodowej Federacji Rozwoju Rodziny. Szanowni Państwo, jestem niezmiernie dumny, że województwo kujawsko-pomorskie ma mieszkańców przeszło 2 miliony, którzy myślą podobnie, globalnie, tak jak inne rodziny, inni mieszkańcy na całym świecie, w trosce o naszą przyszłość, w trosce o nasze dzieci. Rodziną silna jest cywilizacja. Jeśli będziemy o nią dbać na każdym poziomie naszej aktywności, możemy być spokojni również o zrównoważony, pokojowy rozwój i przyszłość naszych dzieci. Serdecznie pozdrawiam z Torunia. Raz jeszcze dziękuję za to wspaniałe wyróżnienie.
Our next awardee, inspired by the experience carried out in the city of Lyon since 2013, the Familia Network was created in 2017 as a group of Maisons de Famille. It starts in every city with the desire of a small group of people to serve couples and families who share the same vision on the importance of promoting family education. These Familia houses welcome and support at each stage of their life all people who wish to develop their relational skills in order to build, strengthen, or restore lasting and quality ties with their spouse, their children, and those around them. The French organization Familia has been granted one of the 2022 IFFD awards for their inspiration in developing a network of maisons de famille so that families can acquire and consolidate relational skills in a professional way and in order to build lasting and quality ties among the family members with specific propositions for every stage in life and ensure a preventative action over mere reaction to conflicts. Congratulations.
Bonjour, je suis Thierry Véran-Lacroix, président et fondateur, avec ma femme Frédéric, du réseau des maisons Familia. C'est avec une immense joie que nous avons reçu le courrier nous annonçant que nous étions lauréats du prix de l'IFFD 2022. Nous accueillons ce prix comme un formidable encouragement à continuer notre travail et à persévérer en vue de rendre les services de Familia accessibles au plus grand nombre de familles. Nous accueillons ce prix comme une opportunité de mieux faire connaître la vision, la mission et les valeurs de Familia. Nous accueillons enfin ce prix comme une reconnaissance du caractère innovant de Familia et du professionnalisme de nos services auprès des familles. Ce qui conduit toutes nos actions, c'est de renforcer l'amour dans les couples et dans les familles et d'aider à guérir les blessures qui peuvent advenir à l'occasion des épreuves de la vie, une séparation, le handicap, l'infertilité, un décès. En France, la famille est plébiscitée comme la première des valeurs. Pour autant, la famille est extrêmement fragilisée. Les conséquences des séparations sont lourdes, tant sur le plan personnel que sur les plans économiques et sociaux. Beaucoup de souffrance et de détresse pour les personnes amenées à se séparer, ainsi que pour leurs enfants. Les séparations sont la première cause de la pauvreté en France. C'est en moyenne 20% de baisse de niveau de vie pour les femmes. Et un tiers des familles monoparentales vivent sous le seuil de pauvreté, contre seulement 7% lorsque les deux parents habitent ensemble. Les séparations sont aussi la première cause du manque de logement. Chaque année, il faut construire 90 000 logements du seul fait des ruptures familiales. Familia est une des réponses à ces fragilisations et accueille de manière inconditionnelle toutes les personnes qui en expriment le besoin. Les maisons proposent une éducation à la vie affective et à la relation à tous les âges de la vie, pour les enfants, les jeunes, les couples, les parents, les solos et les seniors. Des lieux pour apprendre à s'aimer soi, apprendre à aimer son conjoint, apprendre à aimer ses enfants. Des lieux aussi pour aider à guérir les blessures. Notre approche est résolument orientée vers la prévention, car se marier aujourd'hui, c'est décider de passer 20 000 soirées avec la même personne, 3 000 week-ends. C'est pourquoi nous proposons autant d'actions pour construire et prendre soin de sa vie de couple. Notre souhait est surtout de faire évoluer les mentalités. Nous souhaitons rendre l'accès au conseil conjugal aussi ordinaire que l'accès à son médecin, car le conseiller conjugal n'est autre que le médecin généraliste du couple. Nos équipes sont témoins de vies de couple transformées et de vies de famille renouvelées par nos propositions. Nous avons mesuré notre impact social. 73% des couples qui songeaient à se séparer ont décidé, suite à un accompagnement en conseil conjugal, de poursuivre leur route à deux. 1 euro investi dans notre action permet de générer 5 à 11 euros d'économie pour la collectivité dans les 5 années suivantes. Ce prix de l'IFFD vient récompenser le travail de tout un réseau. C'est au nom de tous ceux qui œuvrent à l'ouverture de maisons familiales que nous vous manifestons notre reconnaissance. Je tiens aussi à remercier tout particulièrement nos partenaires institutionnels ou financiers, sans qui tout cela n'aurait pas été possible. Avec nous, ils contribuent au bien des familles et de la société. En leur nom à tous, merci.
Thank you very much, Monsieur Fieron-Lacroix. Now, it's my privilege to introduce Ms. Renata Kasmarska, focal point of the family of the United Nations Division for Inclusive Social Development Department of Economics and Social Affairs, for the closing remarks.
Ladies and gentlemen, I would like to thank the IFFD for organizing this event. Congratulations go to the recipients of this year's IFFD Awards. Thank you all to the panelists for presenting important research on mental health. As noted by the panelists, as the pandemic continues, ongoing and necessary public health measures expose many people to experiencing situations linked to poor mental health outcomes, such as isolation and job loss. The dramatic increase in anxiety and depressive disorders during the COVID-19 pandemic is extremely worrying, especially for young people. Research indicates further concerns around poor mental health and well-being for children and their parents, particularly mothers, as many have been experiencing challenges with school closures and lack of childcare. Both parents and their children have experienced worsening mental health since the start of the pandemic, and women with children are more likely than their male counterparts to report worsening mental health. As noted by the panel, it is especially troubling that the COVID-19 pandemic has led to a dramatic increase in depression and anxiety problems and social risks among urban, racial, and ethnic minority school-age children compared to before the pandemic. There is no doubt that more research is needed to understand if these changes will persist and what will be their long-term consequences. On the positive note, I believe that there is a growing awareness of the importance of mental health. For instance, employers pay more attention to negative consequences of mental health issues and offer assistance to their employees. Here, I would like to mention that the United Nations has recently launched a new initiative, the Workplace Mental Health and Well-Being Lead and Learn program. It aims to develop UN leaders and managers' knowledge and skills to support the mental health and well-being of personnel and create healthy, respectful, and productive workplaces. Leaders and managers in every organization have essential roles and responsibilities to ensure a healthy workplace environment. This includes looking after their own mental health, supporting personnel who are experiencing poor mental health, and reducing stigma that discourages people from acknowledging mental health conditions. I believe such measures are good examples of what employers can do to help manage the mental health crisis we are facing. Thank you all for attending this event. I hope you all stay well and safe. Thank you.
With this, we have reached the end of our event. Thank you very much for your presence here today. Stay safe, and we hope to see you all again in New York next year. Goodbye for now.